Good morning, students. Today we are going to discuss again one very important topic of respiration, that is transport of oxygen. Up till now, we have discussed in detail ventilation. That was the first function of respiratory system, and the second function was diffusion of gases. That also we have discussed. And now coming to the third part of the respiration, that is transport of oxygen. So under these headings, we are going to discuss. First, we are going to see how the uptake of oxygen will be there, how the transport of oxygen is there, how the oxygen is delivered at the level of tissues, and what are different vehicles. So that we are going to see this. Now, if you are coming to this particular figure, we can see the different pressure changes. In the alveolus, it is around 104. In the alveolus, it is around 104. In the venous blood, it is around 40. And in the arterial blood, it is around 95. And if you see at the interstitial level, it is around 40. Whereas at the tissue level, it is around 20. So due to these concentration and pressure gradients, the oxygen from the alveolus will be delivered and transported to the tissues. So these pressures are very much important. Every time you have to remember this. Now coming to the pressure gradient, which is very much important. Here we can see the alveolar pressure is 104, whereas venous pressure is 40. So the first gradient will be 64 millimeters of mercury pressure, and that drives the oxygen from the alveolus to the blood, and then it comes to this level, and it will be delivered to the tissue. But if you look at the figure here, see, you can see that this is around 104. Now, if at the aorta, if you are measuring, it comes around 100 millimeters of mercury. And if it is reaching at the tissue level, it again goes on decreasing. Now, why this decrease in the pressure occurs? From 104, it comes to 100, and then it comes to 95, because there is a venous admixture. This is due to, again, the anatomical arrangement. The bronchial veins will be mixing with the pulmonary capillaries, and the coronary blood is also passing through the Thebesian veins. You must have discussed already this in your anatomy classes. And due to that, the venous blood is mixed with this oxygenated blood, and that is the reason why the pressure is decreased from 104 to 95 millimeters of mercury. So these are the pressures at various levels which you have to remember. This is also known as oxygen cascade, where the process of declining oxygen tension will be occurring from atmosphere to the mitochondria. So if you consider the atmosphere, it is around 159 millimeters of mercury. After humidification in the respiratory tract, it is around 150 millimeters of mercury. When by alveolar ventilation, the oxygen will be uptaken at the level of alveoli, it becomes 104. After adding the venous blood, due to the venous admixture, it comes around 100 millimeters of mercury. The tissues will extract the oxygen, and the venous blood now will have the pressure of 40 millimeters of mercury. At the level of mitochondria, it is around 7 to 37 millimeters of oxygen tension. So this is known as oxygen cascade pressures, which are very, very, very important. Due to these factors only, the gas is transported from the atmosphere to the level of mitochondria, and then only the normal amount of oxygen will be delivered to the tissue, the normal functioning of the tissues will be there. So you have to be again very cautiously see all the pressure changes. So whenever there will be pressure changes, it is going to affect the transport. Now coming to the transport, actually how it happens in arterial blood. In arterial blood, it is in two forms. First, it can be dissolved form, or it can be in combination with hemoglobin. Along with hemoglobin, it is the major form. It is around 97 to 98%. Whereas only 2 to 3% will be in the dissolved form. So these are the only two ways for the transport of oxygen in the arterial blood. Now, oxygen in the arterial blood, if you are measuring, it will be around 20 ml, and in the venous blood, if you measure, it will be around 15 ml. So that means 5 ml of oxygen is transported from lungs to the tissues by 100 ml of blood. So that is the normal oxygen transported to the tissues from the lungs. So around 5 ml per 100 ml of blood. Now in dissolved form, out of 5 ml, 0.3 ml is in dissolved form and rest all will be along with the hemoglobin. Now this dissolved form, the amount may be very negligible, but it is very much important because there is no limit for this transport. As long as the partial pressure of oxygen is high, you can have continuous increase in transport of oxygen in dissolved form. So the dissolved form of oxygen will be always maintained if you are going to maintain the high partial pressure of oxygen. And there will be no limit for this transport. Why this is important? Because in cases of certain poisoning, such as carbon monoxide poisoning, what happens is the hemoglobin will be denatured. So instead of oxygen, the carbon monoxide will be attached. So there is no place for the oxygen to attach, and the oxygen normally will not be delivered by this hemoglobin to the tissues. So the only vehicle which is available will be dissolved form, and then as a treatment we give hyperbaric oxygen. So the oxygen at higher pressure is given to the patient to maintain the oxygenation. Now coming to the very important part, that is how the transport is occurring in combination with hemoglobin. Now under these headings, we are going to discuss this particular topic. Very commonly, this is the most commonly asked long answer question in the examination. And of course, I always say that instead of just exam point of view, you have to understand the concept. If you are going to understand the concept of all physiological system, it is always very good to read your medicines, your third year subjects. So you, of course, understand the pathology, the disease process more better. So the first what we are going to see is oxygenation of hemoglobin, oxygen carrying capacity, what is oxygen hemoglobin dissociation curve, what are the causes of shift of these curves, what is concept of P50, the importance of P50, what is the curve in cases of fetal hemoglobin, what is the curve in cases of myoglobin, and what is the effect of carbon monoxide and on transport of oxygen. So under all these headings, we are going to discuss this particular topic. Now coming to oxygenation. This is again a repetition of your hematology lectures. But this, what happens, the hemoglobin will be combining with 4 molecules of oxygen, and then they will form a reversible combination which is known as oxyhemoglobin. Now this is not oxidation. This is just the formation of oxyhemoglobin, and this is a reversible process. This reversible process takes only 0.1 seconds to happen. At the level of the lungs, where it is high oxygen tension is there will be always association. So the hemoglobin will be combining with the oxygen. But at the tissues level, where there is low oxygen pressure, there will be dissociation of the hemoglobin. So oxyhemoglobin will be dissociated to release the oxygen. So this pressure changes again we have to remember for the reversible process. Now what is oxygen carrying capacity of the hemoglobin? Again, you must have discussed in your practicals also of hematology and in the hematology lectures also. Just a passing reference, 1 gram of hemoglobin can bind with 1.34 ml of oxygen. So that is the normal amount it can carry. Now if you are considering 100 ml of blood and 50 gram percent as a normal hemoglobin, that comes around 20.1 ml of oxygen carrying capacity on an average. But due to different shunts, due to venous admixture, this comes around 19.8 ml actual. So around 19.8 ml will be oxygen carrying capacity of hemoglobin. Now this 19.8, 0.3 ml will be dissolved and remaining 19.5 ml will be transported as oxyhemoglobin. So this is the oxygen carrying capacity of hemoglobin, which is a normal calculation, which is asked in the examination also, in the practical examination also. And this is a very good, simple investigation to diagnose the decrease in the oxygen carrying capacity, which is diagnosis for anemia. So you can do the calculations, find out the male, female normal values and compare with the average normal values, and you can go for the diagnosis. The disadvantage with this transport of oxygen in combination with hemoglobin is that there is a ceiling effect. You know that there are only 4 sites. So if these 4 sites are already occupied by oxygen, there is no place for more oxygen to attach, and that is termed as ceiling effect. In cases of dissolved form, there was no limit, but here there is a ceiling due to the hemoglobin molecule. So that is the disadvantage of this type of transport. The percentage saturation is the average saturation of entire hemoglobin molecule in the blood. So this is like percentage saturation is, suppose there is all four molecules, all 4 sides of hemoglobin molecules are attached with oxygen, that means it is 100% saturation. So like that you can find out the percentage saturation. Now if you are plotting a curve or a graph of partial pressure of oxygen and hemoglobin saturation, then it comes around like this, and this is known as oxyhemoglobin dissociation curve. Now this on the horizontal axis gives the partial pressure of oxygen, and here on the vertical axis it gives the saturation of hemoglobin. Now this is, see, the shape is not linear. So this is not linear, it is having a sigmoid shape. So there is a flat part here and there is a steep decline here. And due to that, a sigmoid shape is there. And this is a particular sigmoid shape. The cause of that we are going to discuss. But let us see how these graph can be interpreted. Now, if you remember the normal alveolar pressure, which is at the level of alveoli, it is around 100. So if you see here at 100 and the saturation here, so around 98% will be the saturation, just less than 100. So around 98% saturation. So that means at the level of the lungs, the hemoglobin, all the 4 sides will be having an increased affinity for oxygen, and it will be immediately combining with hemoglobin. As the pressure goes down, see, as the pressure goes down, see if it is only at 60. Suppose there is a decrease of pressure up to 60. So from 100 it has decreased by 40. So it has been decreased up to 60. Now see the saturation, just below 90. So around 90, 88, 90% saturation will be still there. So what is the importance? This is the safety factor. So even if there is a large decrease in the pressure of oxygen, very less change is seen in cases of saturation. So that is the importance of this part. Then as the pressure goes down, say for example at the tissue level it is around 40 millimeters. So see here around 75 is the saturation. So 3 sides will be occupied by the oxygen of hemoglobin. And as the pressure goes on decreasing, the hemoglobin will start to give out the oxygen and the saturation will be very steeply decline to 0 level. Because this is the part where the tissues pressure is there and the tissues are in need of oxygen. So the hemoglobin, as the pressure goes on decreasing, very immediately it gives out the oxygen. That gives the particular shape. And this is the cause of sigmoid shape of curve. You know that there is a concept of cooperative binding kinetics. What is that? You have the 4 sides, and if first side is bound to oxygen, that first reaction very immediately or within fraction of second it can cause the binding of second molecule, binding of third molecule, and binding of 4 molecules. And due to this cooperative binding kinetics, the shape of the curve is not linear. It goes on slow sigmoid shape. And due to that, it achieves the sigmoid shape of the curve. So when it is association, it is like this. When it is dissociation, it will be again faster. And due to that, the flat shape and the decline shape giving the sigmoid shape to the curve. So if you consider this flat part, this is known as zone A, and this blue part, which is known as zone B. This red part, zone A, is, as we have already discussed, that even if the pressure is changing from 100 to 40, there is no change, so very slight change in the saturation. So the saturation will be maintained at high, even the PO2 falls. And this is the margin of safety which is given due to this flat portion of the curve, and that particular process is known as loading zone. So this part of the curve is known as loading zone, where the lungs, this is the part near to the lungs, so oxygen will be taken up and it will be loaded to hemoglobin. Now coming to the unloading zone. Now this zone B will be the unloading zone. Here the oxygen should be delivered to the tissues. So decreases, the pressure as decreases, there is a oxygen will be released to the tissue, and from 60 it very steeply goes on declining. And this buffering effect, that means very slight change in the pressure also can give out oxygen very immediately. So this is the unloading zone of the curve. And this particular effect is known as buffering effect. Relatively large oxygen will be liberated at minor fall in the oxygen emission. So this is zone A, which is loading zone, and zone B is unloading zone. Now there are some conditions, this occurs normally, but there are some conditions in day-to-day metabolism also that this can affect the affinity of oxygen, of hemoglobin towards oxygen. It can either reduce or it can increase. So that means the oxygen will be attached to the hemoglobin, it is increased affinity. If it is having decreased affinity, it will be releasing the oxygen. Now the conditions when there is decreased affinity, say for example, if there is increase in the temperature, increase in the 2,3 dpg, increase in the hydrogen ion concentration, what happens is that there is a decreased affinity of the hemoglobin towards oxygen. And due to that, at higher pressures also, the oxygen will be released. Due to these metabolic changes, the oxygen requirement will be more, and at higher pressure also, the oxygen will be released. And this causes the shift of the curve towards right side. These changes are known as Bohr's effect. This is again a separate question which is very commonly asked as an short answer question, or it can be many a times asked as a part of long answer question. Only the Bohr's effect. So study again in detail what is Bohr's effect. I am giving you only the concept here. For writing the answer part, you have to again read out your text. So this is the Bohr's effect, where there is reduced affinity of the hemoglobin towards oxygen. And when it occurs, whenever there is increased temperature, increased 2,3 dpg, or increased hydrogen, or in cases of increase in the carbon dioxide. So all these will be metabolic end products. See, if there is more increase in the carbon dioxide, this carbon dioxide has to be taken up by the hemoglobin and it has to be excreted. And as the requirement will be more towards oxygen, the oxygen has to be delivered to the tissues. And due to that, daily these effects can be going on inside our body. And this particular effect is known as Bohr's effect. There's one more question for you. I think for roll number 1, I will give this question. What is double Bohr's effect? So you find out the answer for double Bohr's effect, and again you can make a PPT, make a PDF, and you can WhatsApp me. So find out the cause for that also. The shifts can be due to changes in temperature also. So whenever there is an increased temperature, that may be due to increased heat production, increase in the carbon dioxide pressure due to rapid metabolism, or there may be decreased partial pressure of oxygen due to rapid consumption, or decreased pH due to lactic acid accumulation. So due to the complete metabolism exhaustion, there may be increase in the temperature. As we have already discussed, whenever there is increase in the temperature, there is reduced affinity of the hemoglobin, and it causes the right shift of the curve. The 2,3-diphosphoglycerate is a substance which is formed during glycolysis via the EMP pathway. If it is increased, again it reduces the affinity and it causes the shift of the curve to the right. If it is decreased, it causes the shift of the curve to the left. Now, what is this left shift? There will be increase in the affinity of hemoglobin for oxygen. So the oxygen will be bound to hemoglobin even at the lower pressure. So even if the low pressure is there, still the oxygen is not delivered to the tissues. Now, what are the conditions it occurs? Whenever there is decrease in the PCO2, decrease in the hydrogen ion concentration, decrease in the temperature, or in cases of fetal hemoglobin. So if these are the conditions, the oxygen will be bound to the hemoglobin. That means there is increased affinity and it will not be released even at the lower pressure. So that causes the shift of the curve towards left. Okay, try to understand this concept as it is very commonly asked. Now coming to the concept of P50 and what is its significance. The P50 is the partial pressure of oxygen that produces 50% of saturation. So 50% of saturation of hemoglobin at what pressure it occurs, that is considered as P50. The normal is 25 to 27 millimeters of mercury, and this is very important as the hemoglobin affinity is inversely proportional to the P50 value. So that is the importance or significance of this P50. If there is decrease in the P50, the hemoglobin gets saturated at low PO2 and it causes the shift of the curve towards left. So the hemoglobin at low PO2 also will be saturated and it causes the shift of curve towards left. If it is increased P50, the hemoglobin gets saturated at high PO2 also, and that causes shift of to the right. So these are the physiological conditions and these are the significant conditions where you have to remember that. Nowadays, if you want to become the respiratory physician, if you want to become the ICU physicians, intensivist, these are the values which are very much important. The normal physiology is very much important to maintain the oxygen level inside the body is again very much important. Now, what is the change in cases of hemoglobin which is present in the fetus? As we have already discussed, in the fetal hemoglobin, it has more affinity for oxygen as compared to the adult hemoglobin. So even at the higher, even at the lower pressure, the hemoglobin will attach, will not try to detach the oxygen. So that causes the shift of the curve towards left side. So this is the adult hemoglobin curve, red one, and the purple one is fetal hemoglobin. So even at the pressure, see the pressure changes. Here at this pressure only, it has been started to lose or release the oxygen. But here, even this is a low pressure. Even this is a low pressure, it is still having some attachment. And that is the in cases which happens in fetal hemoglobin. Now, what will be the effect of carbon monoxide on transport of oxygen? Now, it has been seen that the carbon monoxide has 200 more affinity, 200 times more affinity for hemoglobin. So it immediately combines with hemoglobin and forms carboxy hemoglobin. and that decreases the functional hemoglobin concentration. So there is denaturation of the hemoglobin molecule and no hemoglobin or less hemoglobin is available to carry the oxygen, and that decreases the oxygen tension along with the decrease in oxygen transport. This is very serious conditions. Here we have to immediately take the action and we have to provide the oxygen in these particular conditions. And given this particular figure here, but try to understand that if you are going to understand the concept, you can learn this very well. So these are the different curves. We can see here again the oxygen content in the blood and the partial pressure of oxygen is there. This is a normal curve and this is a 50% is there, and if it is a carbon monoxide, this is what is happening to that, and if it is anemia, this is what is happening to that. If it is myoglobin, the protein present inside the muscle, so it is a specialized protein present in the muscle for sustained contraction, because we want oxygen to maintain the contraction. You have this particular important myoglobin present in the muscle. Here, if you plot the graph, it will come as a rectangular hyperbola. See here, this is a sigmoidal shape along with hemoglobin, but if it is myoglobin, then it comes as an hyperbola. So this is as it takes oxygen at low pressure very readily. So the oxygen at low pressure, it takes up very readily. So from here, see from here, if you are going like this, at low pressure, the attachment of oxygen will be more. And due to that, it has a shape of hyperbola. It does not show the Bohr's effect. At PO2, 40 millimeters of mercury, it is 95% saturation. So even see if this is 40%, so this is level is 40%, is around 95% saturation. And hemoglobin will be around 75%. See, only that much 75%. And due to these particular things, see the attachment of oxygen, it also acts as temporary storehouse of oxygen. So it has the ability to combine with oxygen more. So the oxygen binding will be tremendous in cases of myoglobin, which is present in the muscle. So it acts as a temporary storehouse. Now, how the release of oxygen will be occurring? At rest and during exercise. Oxygen delivery at rest is around 1 liter per minute. Oxygen consumption is 5 ml per 100 ml per minute, as already we have seen. So total it comes around 250 milliliters per minute, and it is utilized as 25% utilization at rest will be there. So the utilization coefficient is the percentage of oxygen consumed out of oxygen delivered to the tissue. So if it is 250 ml per liter is 1000, and if you are calculating the percentage, it comes around 25%. So the 25% of oxygen will be consumed out of oxygen delivered to the tissues. So remaining all will be the buffer oxygen which is present. And this buffer oxygen can be utilized in cases of exercise. Now in cases of exercise, the oxygen release will be depending on the severity of exercise, and the delivery of oxygen will be increased by either increase in the blood flow due to increased cardiac output, local arteriolar dilatation, increase in the capillaries. All these changes you must have discussed in CBS, or in case whenever you were having the exercise cardiovascular physiology. Due to these causes, the delivery of oxygen will be increased, and it also increases the RBC count due to ischemic contraction, and that causes the right shift of the curve. So at this is right shift of the curve, where you get increased temperature, increased PCO2, increased 2,3 ppg, and decrease pH or increase hydrogen ion concentration. And all these factors, they happen whenever you are doing exercise, and these factors will cause the curve to shift to the right. So if you are exercising, more requirement of oxygen will be there. So at high pressure also the oxygen will be released. So that is actually we have discussed is known as Bohr's effect. The vehicles for transport are at PO2 100 millimeters of mercury. The whole blood can transport around 19.8 ml. The hemoglobin solution 19.5 ml. Plasma, that means dissolved form, 0.3 ml. So this is the amount of oxygen transported. If the partial pressure is 40 millimeters, the whole blood can transport 5 ml, the hemoglobin solution 1.5 ml, and the plasma solution 0.18 ml. So these will be the values which will be normally seen. So I think this is all regarding the today's session. It was somewhat lengthy, but I just wanted to add one more important factor which I forgot to add in the slide part, that you can measure these pulse of saturation, oxygen saturation nowadays, which is very much important, that invasive method and non-invasive method. The invasive method is in the ICU patients, you can take out the blood and directly measure the arterial blood gases, or in cases of non-invasive method, which nowadays every house is having, the pulse oximeter. The pulse oximeter can be used at the fingers, or it can be used at ear lobules. So different apparatuses are there. You just have to attach it and find out the oxygen saturation, the percentage oxygen saturation. Or in some of the classworks, I think Aman has given the ventilator part. Very nicely, he has discussed that. In that, the ventilator screen also shows the percentage saturation. So these are the methods by which you can find out what is the normal level of oxygen saturation, and which is very important to know, because the metabolism itself will be dependent on this normal oxygen transport. Thank you very much. Again, if you have any questions, you are free to ask me. And role number 1 has to complete the task, that is what is double Bohr's effect. Thank you.